much Eunsung Global for this opportunity. For me, it's a privilege to be here to share my experience, but also to learn. I've been using Focus Dual for a couple of years. But before talking about Focus Dual, let me talk quickly about myself. So I'm Ariel Haus. I'm a dermatologist. Originally from Brazil, but I've been based in London for 25 years. And I'm like a laser guy. I have so many devices, but Focus Dual become very popular in my clinic, and I will explain for you why. So this is my disclosure. So this technology is becoming very versatile, and most of the time I delegate as well for my staff. I have around 20 staff. I have a lot of nurses, other doctors, practitioners, and again, the result we are getting from Focus Dual is quite impressive. During this presentation, I will talk about the technology, my experience, and we have just finished a clinical study, and tomorrow will be the last patient, and I have some of my own pictures to show to you as well. So this is some sign of the age. Probably you know better than me. Most of my patients, they come because they're concerned about wrinkles, nasolated folders, loose skin, skin laxity around the eyes, face, neck, cross feet, pore size. This is very interesting, pore size. I have the new type of patients, like the millennials. Interesting is, they are so concerned about the pore size, more than any other groups. It's very interesting. So for this type of patients, Focus Dual also, it's a very good option for treatment, because the new generation, millennials, they are very concerned about pore size and also preventions. And another group of patients we can have very good result. It's the patients they are concerned about double chin. So the result we are getting with Focus Dual is also quite impressive. Let's talk quickly about the technology. So the Focus Dual system utilizes a combination of 3 effect anti-aging tools in a single system. So we have the fractional needle RF, is a combination of microneedling and radiofrequency with vacuum technology. This is very important because compared to other devices, this is a very important tool. In addition, we have the HIFU, which use high-intense focus ultrasound to produce pronounced lifting, tightening, and long-lasting results. This image is one of my favorites, because you can see here, we'll be able to treat from the top to the bottom. Usually, we started with the HIFU. We use the 4.5 millimeters, because that will be able to treat the very deep into the subcutaneous, the SMAC. When you do that, we can have a very good tightening lift of the face and the neck. An interesting point is, you see the fat area. I always tell to my patients and also for my staff, this treatment is a tailor-made, because some patients, they're very concerned about, for example, like I said before, the double chin. So in this case, we need to do more energy in this area. But there are, for example, young patients, they are concerned about prevention. So in this case, we are going to do less energy because we need to preserve the fat. So, because sometimes if you put, for example, on Google in the UK, put therapy, patients, they are freaking out, because there's a lot of bad reviews on that. Number one, because of the pain. Number two, because of the volume loss. There are some patients, they do not want to lose volume in the face. So I always explain for the patient, this is a tailor-made procedure. And then again, when you can see, we start always to the bottom, to the top. We start always with 4.5 millimeters, then we go to 3 millimeters, 1.5 millimeters, and we finalize with the RF. And when we do the RF, another important procedure for us, because we can do the drug delivery, or nowadays we call cosmetic delivery. Because for that, we'll be able to treat as well PIH and melasma. And I'm going to explain how we do that. So this slide shows how deep we can go with the HIFU. We can go to up to 4.5 millimeters. That is the SMAP. That is subcutaneous areas. We can have very good tightening lift. And again, like I said, if a patient needs, we can treat the double chin, give more contour to the jawline. And also the millennials, which is a new group of patients, they are very concerned about prevention. So the clinical study we did, we have few patients, even they do not have the double chin, but they are very, very concerned. So when you combine these two devices, when you do the RF microneedling, we'll be able to treat the acne scar, scarring, pore size, pore reduction, stretch marks, improve the skin tonus. Then when you use the HIFU, we'll be able to do the double chin, the volume reduction. This is very important. It's a tailor-made, like I said before. So some patients, they do want to preserve the volume. So this, we can have a very good, very precisely, when you do the treatment plan, you can analyze if the patients, they do want to remove the fat or not. And that is advantage because the patients feel more confident when you do that. So you can have also more jawline definition, you can have the eyebrow lift. I do have a lot of patients, they said, Dr. Haus, I'm very scared to go to the knife, I do not want to have blepharoplasty, what can you do? And then I said, we can do the Focus Dual. We always recommend between 3 to 6 sessions and maintenance. Once a year, once every 6 months, some cases once every 3 months. And the patients, they do want that. Because I think surgical procedures, it's going down in some places. And then when you combine the two devices in the same time, which is my favorite protocol, you can have even more lifting, tightening, wrinkle reduction, skin rejuvenation, collagen regeneration, long lasting, and like I said before, when you combine with drug delivery, which I do most of the cases, we also be able to treat melasma and PIH. So again, what we can treat, improve the skin, improvement of the fine lines, the wrinkles, the skin texture, tones, acne scars, keloid scars as well. We use this device with drug delivery, of course. Fat reduction in the body, improve the skin tightening, lifting in the face, in the neck, different areas. So let's talk about very quick about the technology, about the fractional radiofrequency microneedling that use the ultrafine needles to create a thin puncture wound in the skin. Initially, the wound really responds. The RF energy delivered direct into the deep skin layers. It's the only device to use the VAT function to give increased precise and allow safe and deep penetration of the RF into the dermis. They generate and promote the collagen, new elastin. We can use the ultrafine needle, 0.16 millimeters, also 0.25 millimeters when you need to treat more like acne scars or different type of scars. Compared to other devices, for example, I don't like to say names, but for example, Morpheus 8, I found the Focus Dual much more precise for all these tools, but one of my favorites is this. When you have, it's the only device, I still believe it's the only device in the market which they have non-insulated and insulated needles. So non-insulated, the heat is generated, you can see on the first picture, you can see the heat go to the top to the bottom of the needles, and then insulated needles, the heat go only to the lower part of the needle. So these, allows us to treat skin color 5 and 6, and that gives less downtime. It's become more comfortable for the patients, and again, decrease the complications. So I also have some patients, if they have some events, social events, or they have to go back to work, so that's another important tool. We can give the option for the patient. And again, I think it's the only device in the market they do have that features. Again, there are different types of tips, needles, 10, 25, 36. Usually I use 25 is my favorite one, but of course if you have small areas, a small scar, you can use the 10 tip. But again, 25 is my favorite one. The device allows us to give a very precisely the depth of the needle, like 0.5 to 1 millimeters. You can treat the frontalis periorbital area, 1 to 1.5 millimeters, more like zygomatic area, 1.5 to 2 millimeters if you have more intense scars, stretch marks, different areas in the body, and also we can go to up to 3.5 millimeters as well. When I do, again, my favorite protocol, when I do the RF microneedling, I always use drug delivery. And in the end, I'm going to tell you how I use that. This is the healing process. This is also a very nice slide, because you can see in the first slide, when the RF make these little points on the skin, it's like an open door. So then you can take the advantage to do the drug delivery. For example, if it's melasma or PIH, you can use balsamic acid, vitamin C. Now exosomes or polynucleotides is become very popular. Also, I use this for others problem like alopecia as well. So, and I'm getting very good results. So then you can see all the healing process immediately, because when you do these little open areas on the skin, this takes sometimes only a few minutes. So we have the opportunity for these few minutes to add the active ingredients you want. So it's, again, it's a tailor-made procedure. So, and then you can see day 1 week, 1 to 3, and 3 to 6 months when you have the final results. So you can see here the screen of the device, left and right. Left is the RF. It's very versatile. You can, it's touch screen. You can see the depth. You can have a very good control on the device. So immediately after the procedure, you get this erythema. This could be only for a few hours, but again, when you use special active ingredients as a drug delivery, this could be just 1 or 2 hours. So number of treatments, we recommend between 3 to 6, 3 weeks apart. I have done that procedure many times. Sometimes I do, to be honest, in less than 3 weeks, because I can really see the tightening on the skin and the pore size as well. So this is a picture for the company. You can see before and after perioral area. You can see we call this barcode, or smoke lines. You can see the improvement and the texture, the color, and also the tightening. You can see the tightening around the chin, the perioral, before and after. Stretch marks, you can see before and after. You can see the improvement in the texture, in the color of the skin. The skin becomes more smooth, more soft as well. Again, I always, in my protocols, I use drug delivery too. So periorbital area, you can see the improvement. Again, some patients, they are concerned about prevention, or even they want to treat this excess of laxity of the skin, and instead surgery. This is another option. So we can use in the abdominal area as well for laxity, for this assess of the skin. This is scraped skin, stretch marks. And you see here, you can see before and after the improvement of the texture. Look, and you see the fine lines, the glow of the skin, the pore size. So it's 5 treatments. Just use RF before and after. So in this one also you can see the improvement of the texture of the skin after a few weeks, 8 weeks, sorry. So this is a video, I did this video 2 days ago in my clinic. So I always overlapped. So we did a HIFU. I just put this video first because it's the order, but we did first HIFU and then we finalized with the RF. And then at the end, I will show to you how to do the drug delivery. You see overlapped? And it's very comfortable. Of course, I gave painkiller for her. This, listen, I'm very strong. This one I went to 2 millimeters, okay? No, because we do a preparation for the skin before. Well, so yes. So, hold on a second. So, now let's talk about the HIFU. That's the second part of the device. So HIFU is a high-intense focus ultrasound. I've been using similar technology. I should not say the name, but I've been using, for example, therapy for more than 10 years. And then Focus Dual, there is a special tool, a special settings I'll show to you, which I've become very fan of this device, and I will explain for you shortly why. So the HIFU goes to 65 Celsius, the energy created through the ultrasound waves. That is well definitive into the skin, so there is no damage on the skin. And this device also, there is a very good control point because the energy, it will go straight to the point where you want. Because, okay, before I'll go that, you can see here there are different handpiece, 1.5, which go to superficial derms, 3 millimeters go to the deep derms, and 4.5, which go to the mass layers, subcutaneous. When you do that, again, we'll be able to treat all layers of the skins. And again, in some cases, we'll be able to treat the double chin and reduce the volume of the face if the patient needs to do that. And also prevention. So we can use for the body as well. We can use 6 millimeters and 13 millimeters. So in this slide, you can see how deep it goes. Again, in the face or the neck. Usually we start at 4.5 millimeters, which goes very, very deep to the SMAT, subcutaneous. That also be able, if it will be the case, to destroy the fat, okay? To have more tight lift, then 3 millimeters, and then 1.5 millimeters. And then for the body, we can go 6.0 or 13.0 millimeters. Okay, that is again another one of my favorite slides. So the regular transducer, you can see the energy, the heat go through the entire skin to the target area. So when this happens, so when you have energy to the top to the bottom, so what's happened? The patient will feel more pain, will be more uncomfortable, but also there is, for example, when I use therapy, I will tell you something, around 10% of my patients, okay, again, I do a lot of HIFU in my clinic, okay, a lot. Around 10% of the patients, when they use the others device, I don't know if you noticed that, there are sometimes you can have a challenge. The patients can develop, we call the urticariform lesion. It's a kind like a rash on the area. And that takes several weeks to go away, and also you have to prescribe topical steroids. But with Focus Dual, I never have any problem like that, because they have these special features. You see the other side of the slide, the SAT, which is a special design of the transducer, which there is a hole, allows to be very precise the energy. So you see, there is no energy surrounding the skin. The energy goes straight to the target area. So what that means, will be more comfortable, less pain, and much safe to the patient compared to the other devices, to the others, to the regular transducers. So again, I never have any problems using Focus Dual, which the others, around 10% of my patients, they can develop this kind of rush lesions. We call urticariform lesions, could take around 8 to 12 weeks to go away, and nobody wants to have that. And also, with these special features, is much more comfortable for the patient, and you can control more precisely the energy. So treatment procedures, so the energy starts with the lower energy, there are a few shots, and increase depending on the patient's comfortable. We always start with 4.5, then 3 millimeters, and 1.5 millimeters. The space is automatically generated. Number of the lines, again, I always explain this for my patients and for my staff, is tailor-made. Some patients, they have the normal protocol. But if a patient has this double chin, we do 2 or 3 times more lines than the protocol, okay? I think patients, they like to have this tailor-made, the treatment plan is personalized treatment plan. And the outshot, also is much more straightforward, much more comfortable for the practitioner, for the doctors, for the assistants to do the treatment. Yes? Yes, yes, I'll talk to you more about the protocol, yes, and sometimes even more. There are some now protocols, 4.5, you can see face and neck. Again, that's the protocol, but for example, in my family, because double chin, it's can be genetic as well. For example, my family, I always explain for the patients, you can have a chicken neck, you can have a turkey neck, and also you can have like an elephant neck when everything dropped. So it's like my case. So because my parents, both, they used to have this elephant neck. So I had that as well. So I do this treatment sometimes 4 times a year. So, and I do a lot of lines. So, and that's one of the best ways to prevent as well, not just to treat. So here you have the protocol. For example, in this case, the cheeks is around 80 lines, submental 19 lines. But again, if the patient has a double chin, I will show to you another one of my slides. I advise myself to go 2 or 3 times more, choose more lines. 3.0 millimeters, that's the protocol. And again, tailor-made. 1.5 millimeters. So if a patient, for example, if I have a very skinny elderly patient with this crepey skin, also I use 1.5 quite a lot, because that would be very good to treat. Even perioral orbital, sometimes I use that as well. So number of treatments, typically is 1 to 3, but sometimes I advise could be up to 6 treatments. But again, the tailor-made, the company advise between 1 and 3, and you can space 3 weeks apart. And if you want to do the 3rd treatment, you can wait for 12 weeks. But that's the company advice. Sometimes I do more often. The body, around the 3 treatments, and approximately 2 to 4 weeks apart. You can treat different areas, abdominal, thighs, and 4 treatments on the arms as well. So this is some pictures from the company. You can see before and after, double chin. You can see the jawline. You have a much better jawline. Even nasolabial folders, marionette lines becoming more gentle, more superficial. That's another picture from the company. You can see double chin, also the jawline, the nasolabial folder, marionette lines. You can see the periorbital area as well, the improvement before and after. Another picture, just one treatment, 1 week apart. So after 1 week, so you can see the improvement in we call this sometimes this little bag. You can see the improvement. You can see more definition of the jawline. Interesting is, because I work in London and also in Brazil. My patients in Europe, they are very concerned about the jawline. The Brazilians, they are more concerned about the zygomatic area, the apple in the face, so they want more lifting. So you need to understand the type of patients, where they come from, the geographic, I think also is very important. So look, these are the patients from the components of these pictures, the periorbital, the supraorbital area. You see the improvement on the size of the skin 2 weeks after the treatment. Again, this is another picture. So you can see the improvement in the jawline, marionette lines, nasolabial folder. So just one treatment. The neck, also, you can see here before and after, just one treatment. Abdominal area, so before and after. These also very good pictures. Look, the double chin, but that was 5 treatments. You see, again, tailor-made. So in this case, I will do more lines, special 4.5 millimeters. Okay, I could combine with the RF as well, because I do like to combine both in the same time. That's my favorite protocol. So this is another video, the same patient. So we start with this. 4.5 millimeters, we did the face and neck. You see the automatic mode, much more comfortable. If you use other devices, you have to press, continue press. And the practitioners, my assistants, they complain, even myself. Can you imagine if I do 3 patients or 4 patients a day? Sorry, it's another, I have another video now. Yeah.
How are you feeling?
Yeah, very comfortable. With no pain.
Any pain at all?
No, no pain.
For this patient, I gave we put topical Nami cream for half an hour, and also we gave 2 codeine for the patient. So that's my protocol. I always give I'll apply topical LMX4, which is 4% lidocaine, plus I'll give the systemic painkiller. So discomfort management, like I said before, is my protocol. Nami cream at least for half an hour. I will always give painkillers as well. So now I'm going to talk about my own. We are doing a clinical study. I would like to say thank you, Brian, for support us. So this is ongoing. Tomorrow will be the last patient. We finalize the trial tomorrow, but I have some pictures for you. So we did 12 patients, 8 females.